Hello, you're listening to ReviveFM. My name is Henry Scott, and welcome to Scott and Hutch. I'm Scott, and he's
Hutch.
And there's the delay. And you're welcome to ReviveFM. Please do tune in, and please get your friends to tune in. Share the link. Share it on Facebook. Share it on YouTube. Share it on Instagram. Are we on Instagram? No, I don't think so. But follow our Instagram, it's ReviveFM UK, and make sure you call in on 0333 444 0940. That's 0333 444 0940. We're having Jason Strelitz on hopefully later in the show. But in the instance that, as a public health responder, he is generally quite busy. Jason, are you with us now?
I can hear you, yeah.
Brilliant. How are you doing?
Doing really well, thanks.
Lovely, lovely. Now, I bet you must be feeling immensely proud at the minute because of how successful the vaccination program is going.
Well, it started really, really well. So we've got thousands of people in Newham and many tens of thousands across East London who've been vaccinated now. A really decent proportion of people aged over 80, a really large number of frontline health and social care workers, and soon that's going to be really reaching out to people in their 70s as well. And it's massively important. It really is our way out of this coronavirus mess.
Now, what I've got to ask, first off the bat, is I remember last week there was the decision to change the dosing, or was it 2 weeks ago? It wasn't too very long ago. There's the decision to change when to dose people. Now, will this mean that when people get their doses 12 weeks later instead of 3, the vaccine will still be effective?
So that is the assumption of the scientific community that have made, and policymakers that have made that recommendation. They think that absolutely that the immunity from the first dose, from the first jab, will last well beyond when that second dose comes in, and then the second dose will act as that long-term booster. So that's the theory, and the idea is very much to get as much vaccine into people as soon as possible, given the state of the pandemic, to protect the population.
And the other thing I want to ask as well is it a case of, because we're hearing obviously that the Pfizer is the one that's been done first. Are we going to be using up the Pfizer reserves first and then going on to the Oxford AstraZeneca one after that? Because at the moment, I don't know. I've had a few people sort of asking, am I going to be as safe if I've got to have one jab as opposed to 2? So is that a case of how it's working at the moment? It's a case of we're going through Pfizer first and then we'll go on to the next one after that? Or is it just a case of doing it at the same time?
That's not the case. So it depends. We're using both in East London right now. So for example, at the most of the primary care sites, the GP-led sites in the community, are using the Pfizer vaccine right now, but at the Excel Centre, they're using AstraZeneca. They're going to be using AstraZeneca to get out to people who are housebound because it's much easier to transport. So we're using both, and really what happens is that we use the supply that we get given nationally. So it's a combination of Pfizer and AstraZeneca, and at some point we'll also get the Moderna vaccine.
Brilliant. Something I want to ask, Jason, is apparently they're beginning to trial 24-hour COVID vaccination sites in London. Is Newham a part of that?
I don't know that actually yet. I've heard nothing more than what you've heard on the news around that. So I've not had any details about the 24-hour sites. Sorry on that one.
No worries. I mean, we're here to ask questions, and if you've got any questions for us, feel free as well. But it's great to just have you on the show to talk about it, because we're getting it straight from the horse's mouth instead of several people down the line. I was just wondering about the massive the mass COVID vaccination site. I think, is that at the Excel Centre?
That's right. Yeah. It's not just so it's a regional site. So actually, people coming even from outside London to that site.
And does that is there any sort of worry that if we've got people, say, coming from outside of London or anything like that, that could maybe increase the risk of transmission? Or is it a case of it's like, if you have any symptoms or anything like that, like, do not go there whatsoever?
So I think, I think it's being run with a strong view to keeping people safe. I think most people going there will be driving there. It's not the most terribly accessible place by public transport. So I think people will be largely driving there, and then it will be run in a way to really minimise any infection risks. So I'm not too worried about that.
That's great to hear. And also, the other thing as well I wanted to bring up was something that I said in the first hour of the show. So I believe that Newham is still sort of getting over 1,000 confirmed cases in the last week. It's one of only 2 boroughs in London which are still over the 1,000 cases per 100,000 mark. I know there's been a drop of, I believe it was about 22% over the previous week. So for our listeners and people watching, obviously it's kind of good news tinged with a bit of bad. What would you say to those people that obviously we're trying to get that number down in the borough of Newham?
Yeah, so the first thing I would say is I was very, very excited to see that this evening we've dipped below 1,000.
Oh, fantastic!
Which is in some ways just an arbitrary mark, but just feels like a good marker. So we peaked in Newham at over 1,400 cases per 100,000, and now we're below 1,000. And all the evidence suggests that over the next few days, the rate will keep coming down. So my message to people listening is everything you're doing to control the spread of the virus is working. It is working. Keep going, keep going, keep going. It's making a massive difference. The rate is coming down. That quite quickly feeds into reduced numbers of people going into our hospitals. It has a massive difference. It's going to keep coming down, I hope, consistently for the next couple of weeks too. And what we want to do is to get the rate absolutely as low as we possibly can do. We want to suppress the virus in the maximum possible way. It's still high, don't get me wrong. Creeping under 1,000 is not really is not a cause for popping balloons and champagne corks or whatever the expression is. It's very, very high, and we need to see it come down really hugely from there. But we're going in the right direction. The steps that people are taking to minimize social contact with others, as hard as it is making a big difference.
I've got 2 questions here from actually some of our listeners. If you're feel free, if you like, they're beyond your scope. But I've got someone from a campaigning group saying, why do they want to work Sunday in rolling out the vaccine? Is the plan to work? Is the plan to eventually roll out for 24/7?
So I could say I don't know exactly. I think we're already doing it 7 days a week. So the vaccine centres are already open 7 days a week. So like I say, I'm not entirely clear what the plans are for 24/7. Personally, I don't know how many people want to go get a vaccine at 3 o'clock in the morning. And I also, think we have to consider our staff, our NHS staff who are dealing with the second wave right now. And getting a vaccine program up and running are doing an absolutely amazing job, and they are running on fumes. And I think as quickly as we want to do this, we also need to respect the basic human needs of our staff and our workers who are out there doing this incredibly hard job. Like I say, they're trying to get this vaccination program going at the same time as dealing with a very, very, very challenging second wave. So, policymakers will decide whatever they're going to do, but I think let's all bear in mind that we need to look after our healthcare staff as well.
Definitely. And my second question is a question that's been, pinging around my mind for quite a while now, and it's to do with the vaccine. Is it likely that we will need to revaccinate a lot of people in about a year's time? Could coronavirus, this stress, COVID-19, end up being sort of more a seasonal thing that we have to vaccinate the country for all the time? Or will this vaccine give us lasting immunity?
So we just don't know. It's we just don't know. It's all too new. And there are a lot of unknowns, both in terms of the virus itself and how it mutates and changes, and the long-term effectiveness of the vaccine. It is entirely possible that, as with flu, we will need to do a vaccination program every year, and this will be a rolling thing. we just don't know, and only time we tell. We kind of need to get over this bit first, and then see how the science develops, how the epidemic develops. What I'm led to believe by those who are far more expert in these things than me is that the good thing is that the technology that underpins this vaccine is very adaptable. So if it needs to be adapted to new strains, etc., it doesn't need to go back into a kind of a huge new process of scientific development. That the fundamental science is there, and that they can amend it relatively straightforwardly going forward. So that's hopefully to give people some confidence that it's not back. If a new vaccine is needed, it's not a case of back to square one. It really is a case of adapting what we've got.
So it wouldn't have to be sort of go through trials again or seek certification. That would still be okay off the initial research and development done.
I'm not sure about all of those details, but what definitely doesn't need to happen is the fundamental scientific development.
Wow. So I think by the sounds of it, we are starting to get a handle on it, which is amazing to hear. I mean, I know that my dad's actually had the first shot of the Pfizer vaccine this week, Friday just gone. Yeah, he's sort of quite happy about it. I mean, he's 65, but he has blood pressure. Well, it's only because he has a very low resting heart rate, so that's how he's been classed as high risk. But I was sort of asking him because I wanted to try and get him on the show, but he doesn't want to do radio or anything like that. And he was basically saying that it was just a case of like, my arm was a bit sore for the first bit of the day, but he's had no side effects or anything like that since. So
that's most people's experience, yeah.
That's it. Well, I mean, there is a joke I could say, but unfortunately we're live on the air, but I can't. But it deals with another name for a needle. So I said he's had me for 30 odd years, so he must be used to it. But but I think it's great to hear though that we're getting this rollout done. Dare I say it, quite effectively, and I'm hoping that, like you say, off the back of the figures that you said for Newham this week, we'll be able to sort of hopefully celebrate a little bit more by keeping it below the 1,000 mark next week.
Well, yeah, we want to just keep 1,000 is still very, very high, so we need to keep doing what we're doing, and hopefully by this time next week it will be substantially lower, like several hundreds lower than it is right now.
Yeah.
Jason, I've got quite an important question to ask you, and it's that the government have been telling us that we really do need to abide by these lockdown restrictions, because the NHS could be completely overwhelmed. How bad is it?
It's really challenging. I think I can't overestimate how challenging it is, and that for all of our NHS staff working in hospitals, it's been an incredibly challenging time, and that wave one was incredibly hard, and the levels of admissions have exceeded that. So it's been hugely hard, and I really hope for them and for our communities that we are slowly on the better side of this. Although I think it's going to be, they're going to be dealing with a challenging situation for many weeks to come.
Is there anything people can do to help you out, to help the NHS out?
Well, I would say three things. One is stick to the rules, because every infection that we avoid happening helps to reduce that rate overall and makes a massive difference, and reduces the chance that someone becomes very unwell from coronavirus. Number two, to help with that, if you have to leave the house regularly for work or for caring for someone, get yourself regularly tested. We've got rapid tests now available at many sites across the borough, and people can go for people without symptoms who have to leave the house regularly to try and pick up on that asymptomatic spread. Remember, one third of infections from coronavirus are passed on by someone who has no symptoms at all, who has no idea that they've got coronavirus. So if you have to be out of the house, get yourself tested regularly to try and avoid spreading COVID inadvertently. And number three, if you're offered the vaccine, take the first available appointments, because that absolutely gets our community protected as quickly as possible. So those would be the three things that people can really do to help.
Brilliant.
Thank you so much. Is there any last message you'd like to give out to the listeners of Newham, or anything particularly you'd like to say to us?
No, just stay safe. Keep doing what you're doing. We are collectively we're bringing that rate down, but we need to go much, much further before we're in a place where we can all get back to living life the way we want to and life as normal. So that's it.
Brilliant. Listen, Jason, thank you so much for coming on. I believe you'll be with us next week.
I hope so. That'll be good. Yeah. Hopefully.
Brilliant. Yeah, we're back on.
About even lower rates then.
Yes,
exactly.
That's what we'll be hoping for.
And more vaccinations. Brilliant. Keep
Brilliant.
well.
We will. Thank you so much, Jason. Please do keep well yourself. To all our listeners, if you'd like to ask Jason questions, he'll be with us next week at 6 p.m. Please do drop us some comments and the links in the description, or maybe even call in next week at 0333 444 0940. We've got Newham's very own NHS correspondent here, so it'd be brilliant to have your questions. Anyway, thank you very much, Jason, for coming on.
Revive FM
94.0 on the radio,
on your mobile
and online.